Good morning. My name is Gerdien Tramper. I'm very grateful for the SBIT Fellowship Award received and for the possibility to share my research work. My research topic is about infections and exacerbation prevention by immune modulation with bacterial lysates in patients with asthma. Bacterial lysates consist of lyophilized bacterial fragments obtained by mechanical or chemical lysis. They are used since the 1950s to prevent respiratory tract infections. Several meta-analyses have shown a 30 to 30% reduction in the respiratory tract infection episodes, mainly in children. Recently, bacterial lysate treatment gained renewed attention because of greater knowledge about the gut-lung axis. This simplified drawing shows the mode of action of bacterial lysates. They are taken orally, and the bacterial fragments are presented in the gut, where they activate dendritic cells, leading to migration of immune effector cells to different body sites. Immune modulatory effects have been found locally and systemically. In case of the airways, local effects of antibody production, regulatory T cell numbers, and Th1-Th2 cytokine balance have been shown. This in turn led to increased protection against airway pathogens and decrease in airway hyperreactivity. However, mechanistic data mainly derived from animal studies and few very small children studies. We performed a meta-analysis into the effect of bacterial lysates on wheezing and asthma episodes, in many cases caused by viral infections. For both preschool wheezing and childhood asthma, there was a significant reduction of episodes after bacterial lysate use. However, these studies were small and very heterogeneous. Because of previous data, we hypothesized that bacterial lysates would prevent viral-associated asthma exacerbations in older children and adults. We were also very interested to elucidate working mechanisms and/or biomarkers. To study this, we initiated a randomized controlled trial with 75 patients between 12 and 60 years. They were all on GINA step 4 medication, meaning moderate to severe asthma, and having 2 or more exacerbations per year. They received blinded OM85 or placebo for 2 winter seasons. OM85 is a bacterial lysate consisting of lysates from pathogenic respiratory bacteria. Participants were seen 3 monthly and during exacerbations in the clinic for evaluation and biosampling. The primary outcome was the number of exacerbations requiring oral corticosteroids and/or antibiotics. Secondary outcomes were clinically, microbiologically, and immunologically. With respect to the primary outcome, we could not find a difference in number of exacerbations between the 2 study groups after 18 months. The incidence rate ratio was 1.1. Pulmonary function showed a trend towards a higher FEV1 after 1 study year in the treatment group. Medication use was identical among the groups. Because of previous data and childhood asthma being mainly allergic in origin, we performed a post-hoc analysis in a study group with type 2 high allergic inflammation, adherent to the study protocol. This analysis showed a trend towards a decreased number of exacerbations, especially after 6 months of treatment. Also, antibiotics and corticosteroid use was lower, but this subgroup was too small to draw firm conclusions. In future studies with adult asthma, this group with type 2 high asthma should be specifically addressed. We looked at distribution of viral-associated exacerbations. Of the patient with an exacerbation seen in the clinic, about 54% had a nasopharyngeal respiratory virus. In patients allocated to the OM85 treatment, the percentage of viral-associated exacerbation was identical compared to the placebo group. During exacerbations, intracellular CD4 T cell cytokine production was more pronounced in viral-associated exacerbations, with an increase in type 2 cytokines IL-4, as shown over here, IL-5, and a decrease in interferon gamma production. Current laboratory work focuses on the relation with innate lymphoid cells type 2. These cells are associated with asthmatic symptoms following viral respiratory tract infections and might produce Th2 cytokines themselves and by stimulation of specific Th2 cells. For the type 2 inflammation high patients adherent to the study protocol, detailed immunological studies were performed to compare the OM85 group to the placebo group. We noticed a trend in a decrease of blood eosinophils and an increase in serum IgA. Plasma cytokine measurements showed a more than one-fold change in the immune modulatory IL-10 in the OM85 group, but not in the placebo group, as shown in the right figure. We also performed flow cytometry analysis to study differences in time with respect to treatment modus. We specifically looked at T12, being 1 year after the start of intervention, to exclude seasonal effects of inflammation. There were no clear differences in B and T cell subsets, also not in intracellular cytokine production and regulatory T cells, as shown in all these figures. Concluded, what have we learned till now about this project? Bacterial lysates might act different in adult and/or severe asthma compared to preschool wheezing and childhood asthma. The effect of bacterial lysates is less strong. If there is any effect, it is probably in the allergic or T2 high asthma group. We also question whether the dose and/or treatment regimen might be adequate for adult immune modulation. Next, some systemic immune modulatory effects are observed. We should probably look more locally. We will study induced sputum in the future and also the local respiratory microbiome in relation to inflammation. Next, viral-associated exacerbation show different T cell cytokine production compared to non-viral associated exacerbations. We will further study the role of ILC2s in exacerbations and the relation with B and T cell subsets. The mechanistic pathways of OM85 are still not very well elucidated. In the future, we will perform stimulation assays, and we started with clustering analysis to see whether we can cluster the OM85 and placebo group based on clinical and immunological parameters. The ASPID Fellowship has acted as a springboard grant for me and has enabled me to set up my own research line into prevention and typing of infectious respiratory disease exacerbation. First, we have initiated a follow-up study of the BREATHE study aimed at detailed typing of baseline state and exacerbations with viral, microbiome and flow cytometry data. This study was partly funded by the Lung Foundation and the Dutch Asthma Foundation. Next, a new study called Protecting Late to Moderate Preterms from RTI and Wheezing in their first year of life by using bacterial lysates is being awarded a consortium grant this year by the Dutch Lung Foundation. We aim to study prevention of respiratory tract infection and wheezing in 500 moderate to late preterms, combined with an innovative analysis into immune and microbiome development. By systems biology, we aim to find biomarkers predictive for disease and treatment success. This is all to start in 2021. Most of all, I would like to thank all partners in research. Without them, it would have been impossible to work on this project. And again, I would like to thank ASPID for the Fellowship Award. Thank you.